Self-medication can be a risky practice that poses numerous dangers to individuals. In this essay, we will explore the various dangers associated with self-medication in detail, covering topics such as misdiagnosis, adverse effects, antibiotic resistance, addiction, and the importance of seeking professional medical advice. The aim is to shed light on why self-medication should be approached with caution and to emphasize the significance of consulting healthcare professionals for proper medical guidance. Self-medication is the act of diagnosing and treating one's own medical conditions without the guidance of a healthcare professional. While it may seem convenient, cost-effective, and time-saving, it is not without its dangers. In this essay, we will delve into some of the key dangers associated with self-medication. Misdiagnosis and delayed treatment. One of the primary dangers of self-medication is the potential for misdiagnosis. When individuals attempt to diagnose their own ailments, they often lack the necessary medical knowledge and diagnostic tools. This can lead to a misidentification of the underlying health issue, resulting in the administration of inappropriate or ineffective treatments. For instance, a person with a persistent cough might assume it's a minor respiratory infection and self-prescribe over-the-counter cough syrup. However, the cough could be a symptom of a more serious condition, such as pneumonia. By self-medicating without proper diagnosis, the individual may delay receiving the appropriate treatment, potentially allowing the underlying condition to worsen. Adverse effects and allergic reactions. Another danger of self-medication is the risk of experiencing adverse effects or allergic reactions to medications. Many over-the-counter drugs and supplements can have side effects, especially when not taken as directed or when combined with other medications. Without professional guidance, individuals may inadvertently put themselves at risk by taking medications that interact negatively with their existing health conditions or prescribed medications. Furthermore, allergic reactions to certain drugs can be severe and even life-threatening. Without a healthcare professional's oversight, there is a higher chance of encountering such reactions, as individuals may not be aware of their allergies or sensitivities to specific medications. Antibiotic resistance. The improper use of antibiotics is a critical concern in self-medication. Antibiotics are often prescribed to treat bacterial infections, and their misuse or overuse can lead to antibiotic resistance. When individuals self-medicate with antibiotics, they may not complete the full course of treatment, take them for the wrong conditions, or use outdated antibiotics, all of which can contribute to the development of antibiotic-resistant strains of bacteria. Antibiotic resistance is a global health crisis that can render these life-saving drugs ineffective, making once treatable infections potentially fatal. The inappropriate use of antibiotics through self-medication is a significant contributor to this growing problem. Addiction and dependency. Self-medication, especially with over-the-counter or prescription medications, can also lead to addiction and dependency issues. Some individuals may self-medicate with pain relievers, sedatives, or other substances to manage physical or emotional discomfort. Over time, this can lead to tolerance, meaning higher doses are needed to achieve the same effect, and eventually, addiction. The dangers of addiction associated with self-medication are not limited to prescription drugs. Even over-the-counter medications, when used excessively or inappropriately, can lead to dependence, causing individuals to rely on them for perceived relief and potentially suffering withdrawal symptoms when they try to quit. Delay in seeking professional help. One of the most significant dangers of self-medication is the delay in seeking professional medical advice. When individuals attempt to manage their health issues independently, they might perceive their condition as less serious than it actually is, leading to procrastination in seeking proper medical attention. This delay can have severe consequences, as certain medical conditions, if left untreated, can progress to advanced stages that are harder to manage or cure. For instance, someone with persistent abdominal pain might initially self-medicate with over-the-counter pain relievers, assuming it's a minor issue. However, the pain could be indicative of a more significant problem like appendicitis, which requires immediate surgical intervention. Delaying professional medical care in such cases can be life-threatening. Inadequate knowledge and training. Self-medication is risky because individuals lack the comprehensive medical knowledge and training that healthcare professionals possess. Medical professionals undergo extensive education and training to understand the complexities of the human body, diseases, and appropriate treatment modalities. They are equipped to make accurate diagnoses, consider individual patient factors, and provide tailored treatment plans. In contrast, individuals who self-medicate may base their decisions on incomplete or inaccurate information obtained from the internet, friends, or family. This can result in suboptimal treatments that may not address the root cause of the health issue, potentially leading to complications or prolonged suffering. Risk of polypharmacy. Polypharmacy, the concurrent use of multiple medications, is a significant risk associated with self-medication, especially among individuals with chronic conditions. When people self-prescribe or use various over-the-counter medications, they might unknowingly create harmful drug interactions. These interactions can affect the efficacy of treatments and lead to side effects that were not anticipated. Polypharmacy can be particularly dangerous for older adults who may take multiple prescription medications. Self-medication can add to the complexity of managing their drug regimens, increasing the risk of adverse reactions and medication errors. Lack of monitoring and follow-up. Healthcare professionals play a crucial role in monitoring the progress of a patient's treatment and making necessary adjustments. With self-medication, there is a lack of proper monitoring and follow-up. This means that if a chosen treatment plan is ineffective or if the condition worsens, there is no healthcare provider to assess the situation and make necessary changes. In some cases, individuals might experience initial relief with self-medication, but their condition could deteriorate over time. Without regular checkups and follow-up care, the opportunity to address such changes is missed, potentially allowing the condition to become more severe. Psychological impact. Self-medication can also have psychological repercussions. Individuals who rely on self-medication to manage their health may experience anxiety and stress related to making the right choices. They may constantly worry about whether they are taking the correct medications or following the proper dosage instructions. This psychological burden can affect their overall well-being and potentially exacerbate existing health conditions. Moreover, the stress and uncertainty associated with self-medication can lead to a reduced quality of life. Legal implications. Self-medication may also have legal consequences. In some cases, individuals might acquire prescription medications without a valid prescription, which can result in legal issues. Misuse of certain substances, such as controlled drugs or opioids, can lead to legal penalties, including fines and imprisonment. Additionally, if someone experiences adverse effects or harms themselves due to self-medication, it can raise legal questions about the individual's actions and potential liability. The importance of seeking professional medical advice. In light of the numerous dangers associated with self-medication, it is essential to stress the importance of seeking professional medical advice. Healthcare professionals, including doctors, nurses, and pharmacists, have the knowledge and experience to provide accurate diagnoses, recommend appropriate treatments, and offer guidance on medication use. They can also monitor a patient's progress and make necessary adjustments to the treatment plan. Furthermore, professional medical advice ensures that individuals receive evidence-based care tailored to their unique health conditions and needs. It reduces the risk of misdiagnosis, adverse effects, antibiotic resistance, addiction, and other dangers associated with self-medication.